Welcome to the Nomad Doc Healthcare podcast. Today we've got a wonderful guest with us, but I'm going to let him introduce himself. His name is Shoga Oni, and I will let him say hello.
Thanks for having me, Ivy. Like you just mentioned, my name is Shoga Oni. Full name is Oluwa Shoga Oni, and I'm the CEO at MDAS Global. So.
Yeah, very warm welcome to the podcast. So tell us about your journey into the health tech industry. How did you land in this industry?
So I landed in this industry the day I was born because I was born in my dad's hospital. I come from a family of medical doctors. Funny enough, I am not a medical doctor myself, and I studied engineering. Being someone whose family all exist around the healthcare space means that, the healthcare space means a lot to me. So when I was looking for a problem to solve, when I knew I wanted to start something and I was looking for a problem to solve, the healthcare space just seems like the best way to start because I grew up in that space. Almost everybody in my family works in the healthcare space. My brothers are doctors, my sister is a nurse, my other sister is a social worker. And so I knew a lot about how care happened, and for me it was about, can I improve the quality of care? And when we started by solving a problem that my dad has, which is access to high quality equipment for his hospital. And then by falling in love with that problem and trying to see how that problem leads to better healthcare outcomes, we're able to just pivot to what we do right now, which is a network of diagnostic clinics across the nation.
And that is beautiful. So I guess we can say you come from a medical dynasty, so to say.
And you're yeah. I don't know if one generation is dynasty level yet, but maybe we're working towards it.
So, I would describe your company as building sort of like the Amazon for diagnostics care. Why have you chosen diagnostics versus all the other challenges in health industry? I know you alluded to it being one of the problems in your dad's hospital.
To be fair, I didn't just pick diagnostics. We picked the problem around how do you create access to medical equipment. But it just so happens that diagnostics is filled with medical equipment, right? So you need a lot of medical equipment to do diagnostics. So that was just a natural fit for it. But what we started with, was how can we improve healthcare outcomes for Africans? One of the ways we were thinking about that is if we solve the problem of equipment for doctors like my dad, that will get better, right? But when all of the different models we ran, we never really nailed it until we said, hey, how about we create our own clinics where we aggregate the equipment in one location, and then we can also aggregate demand from multiple primary care clinics across whatever city we situate ourselves in. And that's what really worked out for us. So I think the medical equipment, even if you look at the name of the business, it's called MDAS, stands for Medical Devices as a Service. That's literally what we started with. It just happens that diagnostics is one of those places where if you don't have medical equipment, you can't do diagnostics. So it just made it a natural fit. And it also happens that diagnostics is one of those places where not many people can do a lot of work in because of how capital intensive it is. So any Tom, Dick, and Harry can go start a small, clinic. Any doctor can start a small clinic. Any pharmacist can start a small pharmacy and sell drugs because you just need a store to rent and then products to sell. But if you want to set up a diagnostic clinic, you need X-ray machines, ultrasound machines, all of these big, heavy machines that cost a lot of money. So that serves as a barrier to most people. So when you look across the nation, you see that the quality of diagnostics that happen in many places is subpar. And so for us, that's the problem we set out to solve, where we want the quality of diagnostics in, say, Share, Kwara State to be equal to the quality of diagnostics you get in VI in Lagos, so yeah.
Yeah, and that's pretty amazing. How many states in Nigeria are you operating in at the moment?
Right now, as of today, we're operating in 14 states. In 2 weeks, we'll be operating in 15 states because we are launching our Kano location.
Awesome.
So we're really excited about that. That is like our first core north location. So we're in Abuja already and we're in Kwara State. But in
Yeah.
terms of core north,
Yeah.
I think that's our first one and our biggest one. And so we are really, really excited about that expansion. So
Yeah.
yeah, and our mandate is literally to be in every single state. So we are
Yeah.
fitting today. Hopefully, when you talk to me a year from now, I can tell you that
Yeah.
we're in 20 or 25 states. So yeah.
And that's pretty awesome because how long has MDAS been operating for?
We're gonna be 10 next year. So this year is 9 years of work. So this has definitely been a long journey for us.
Yeah.
It's exciting work. It's very impactful work, but it's also been, it's not been like we've not been an overnight success, unfortunately.
I don't think anything in healthcare is overnight success, really, is it?
Yeah.
Yeah. So, what are the challenges? You already mentioned one of them, which is, this is capital intensive. But what are the challenges around setting up a network of diagnostic centers?
So challenges right now that we're facing is obviously growth capital is a challenge for us right now. Even though the business model is like perfect for the markets, we have product market fit and we have scaled quite a bit. But in terms of getting to true scale, which for us, true scale means we are in every single state. And we have at least 2 locations in every single state in the country. That's what we consider true scale. Getting there means we need more capital to build clinics. And getting debts, obviously, from the Nigerian banks has been almost impossible with the interest rates right now of
Yeah.
30% thereabout. You cannot really build with that. And so that's been the main challenge we're facing right now. And then we also, we're growing quite rapidly. We have over 350 team members we have to manage. Managing people is always not easy. So having a system to manage the team as we grow and maintain the culture of high performance is also something we figuring out as we're also growing. So those are some of the key challenges we face, and we're navigating through some of that right now. So
Yeah, I think you uniquely just expressed that, human capital, financial capital, and having the
yeah,
strategy to keep people and money working together. That's
exactly.
always the fulcrum of healthcare challenges. So, just going along the lines of strategy and how you make things work, you've just talked about opening in Kano, for example. So, how do you strategically decide where the next new center is, where the next, diagnostic place would be?
Yeah, so when we were younger, we had to be more strategic about this because we needed to do we needed places where we can quickly break even and so that we can keep growing, so that we can get investor buy-in. But right now, given our big vision to be in every single state capital is fair game for us.
Yeah.
So sometimes it's hard to find real estate. Also, because we're a retail business, real
Yeah.
estate is location is one of our biggest thing we have to figure out. If you get the location wrong, it's harder for the center to break even. So right now, it's mostly about where can we find the real estate and how easy for us to find real estate. That's the barrier, really. And
Yeah.
every single state that we don't have a presence in is fair game to us. We currently work across tier 1, tier 2, tier 3, and tier 4 towns. The way we define tier 1 is only Lagos, Abuja, Port Harcourt because of commercial activities, oil and gas money, government money, right? That's tier 1. Tier 2 are the other state capitals, so Ibadan, Osogbo, Ilorin, Akure. These are tier 2 cities. They have federal money going through them, so there's like a sustainable economy in those places. Tier 3 are commercial towns that could have been a state capital but not state capital. So example of that would be Offa, Ondo. They're quite commercial. Ota, like they're quite commercial cities, but they don't have a state capital there. So as a result, they pretty much almost at the level of the tier 2 cities, but they're not quite tier 2 because they don't have federal government money. And then tier 4 is like the towns and villages that I grew up in. I grew up in Ikaria, Koko, Ondo State. It's a town of about, I think, 100,000 people. A little bit commercial, but not nearly as big enough. And we can walk across those 4 locations comfortably. And so in Nigeria, there's literally like at least 300 places we can go to and be comfortable there, right? So it's a big market for us. We think it's like blue ocean. And so whenever we find these sort of locations, sometimes opportunistic. For example, one of our team members was driving through Ore found a location for us, give us a call, and we locked that. And so we were going to launch that place before the end of the year, right? So it's sometimes it's like just finding the right location makes us able to move. Yeah. So yeah.
Yeah, so there was so much you said in that. So again, I want to unpack a little bit. So you talked about, the tier 1 to tier 4 type towns. Obviously, those places require different strategies in terms of running those diagnostic centers. And you mentioned about human capital earlier on. How do you find the right people to lead in those locations? Because obviously you can't be, in all these places at the same time. And to make sure that you maintain culture and maintain consistency of the service that you provide.
Yeah, that's a good question. So oftentimes, we have a system where for our manager roles, we always promote internally for that, right? So, funny enough, the folks we've discovered that are the best suited to be managers are typically our front desk officers and our billing officers, because they deal with the patients and they deal with other clinical rooms, and they also interface with doctors, right? So they already understand what it takes oftentimes, and so we tend to just promote to. So when time there's a vacancy, we announce to our whole team and say, hey, who wants to be a manager? Or we would propose to, sometimes we'll have team members we think is a fit. We say, hey, do you want to move? And then we'll move them to the new location, set them up there, and then they become managers. And then they get a nice salary increase, and then they set up their life there, and oftentimes they don't want to leave that town anymore. Yeah. So that's how it happens, really. But then because we are, our business is obviously operations intensive, and so we operationalize like every aspect of the business. So, for example, if you walk into my Lekki location, and the way you get booked is exactly the same thing you go through if you'd walked into Offa location. The same playbook, like literally, like we drill it to our folks, and so there's a playbook that we follow in how we treat the patients and stuff. Like we kind of like invest a lot in training people that way. And so when you join us, you get trained in the MDAS method. If you're front desk officers, you know what you can or you cannot do. We also run our system using tech. So the tech is a big piece. It's one of the things actually that enables us to do what we do. So the tech pretty much make sure we do work in a certain way. So you cannot do work anyhow, because, for example, if you don't book a patient in the front desk, you don't see that patient in the room. So you cannot attend to that patient. The patient data won't even show up, right? Right. So, and if you don't, when you send for reporting, if you don't send for reporting, the doctors don't see it, so they can't even report it. So, like, so we kind of like streamline everything and just make sure that we have a process for it. So, and that's why we can keep scaling, because the problem with at-scale diagnostics businesses, that's, I won't say anybody's at scale, to be fair, but with people like us who have 2-3 locations, is that like once you reach that location number 5, the complexity of managing it kind of breaks you down, and you can't scale anymore, because you're dealing with fraud, you're dealing with someone doing something under the table and stuff. Well, all of those things we don't really have to worry about, because we have a system. So it's copy and paste, copy and paste, copy and paste. Like, everybody knows. And oftentimes, even when we hire new people, they go to train in our existing center, in addition to a manager that is already very vast in our method of doing things. It's just like cookie, we don't really have to worry about that. We have other problems, but not like, the operation side of things.
And again, that's so beautiful. It's like almost like a masterclass in keeping your human capital, because a lot of businesses, especially healthcare businesses, have a high attrition rate. And it sounds like you've cracked that nut, which is you're making people believe in the vision of the company through training, investing in them. And you're also making sure that people have aspirations within the organization. So, I can imagine someone who is a front desk officer becoming a manager is quite a big jump for them in status and in terms of also developing their own personal potential. So you mentioned having a training program. Is this a formal academy, so to say? And how long do people go through that? Or it's
so it's not really formal. So oftentimes it's like working with people who've been there, done that. So when we hire, for example, for the Kano guys, because we're going through that process right now, we're taking all of our front desk officer and billing officer to Abuja to train there for 2 weeks.
Okay.
Right. So there's hands-on training. They seeing what's happening every single day, so they know they're not surprised. They see different situations and they see how we're managing them, so that when they encounter those things, they know what to do. So it's really hands-on training in that regard. So yeah.
Yeah, and how do you impute? So you mentioned systems and making sure you have systems in place for everything. How do you audit that stroke, make sure that those systems are still robust as things evolve and as the business grows as well?
Just you keep developing them. That's the solution. So usually, at different scales, you need different systems. So when you're running a diagnostic network of 5 locations, it's different from when you're running 10. It's different from when you're running 20. So right now we're running 24 locations across 2 countries.
Okay.
The next evolution is 50. So our current systems might probably help us to when we get to close to 50, and then we need to like re-architect a few things and say, you know what, we would automate this part that our folks are doing manually, and that's what we're doing right now because we're preparing for the next growth spurts, right? So we're automating some of the things we used to do manually before, and that reduces, complexity of managing the business. So yeah. So you never really stop. It's not like you build a system and say, yeah, I'm done and rest on your horns, right?
Yeah.
You keep building them and keep refining them, and sometimes they break and then you fix them. And so that's what we do.
Okay. So one of the questions I wanted to go back to is about financial capital. We've kind of already talked about the fact that it's quite expensive to buy equipment. How do you, because, again, the traditional thing in Nigeria is that our maintenance culture is not great. And so how do you maintain, the equipments that you have in the context of not necessarily having the manpower to maybe repair some things locally? Or is that something that's not an issue for you guys?
No, so keeping our equipment operational is obviously big for us. And that's one of our biggest advantages, because when we move to a new location, why will anybody want to refer to us if they have someone they're referring to before, right? But one of the things we used to when people always like, our equipments never break, or if they break, they get replaced immediately. So we're always available. So other people, if you're a single doctor, if your X-ray machine breaks, it might be 2 to 3 weeks where you don't have that machine operational, right? Mm-hmm. But with us, the next day we have it up there, or we have a replacement for it. So that way people can count on us. So it's that being able to rely on us for many, many things. That's why we gain so much traction in so little time. But to be honest, that's when we started. You remember, we started with selling equipment, and part of selling equipment is also providing service support for the equipment you sell. So we developed how to maintain and fix things internally with our team members and with a team of contractors that work for us. Right. And so we have a robust team now that actually fixes equipment and control the maintenance schedules of all of our equipment nationwide. And we're checking off all of our centers to make sure that they're doing it every single week, because we don't want things to break. We want to prevent stuff. So because we are like a team of we have over 24 locations, we had to build a team to kind of do that for us, and that makes it easier. It's one of our advantages. We don't talk too much about it, but yeah.
But that's wonderful. I mean, because that's being proactive, and actually will probably save more money in the long run because you're not having to do so. So one quick thing, I know you've got people who can fix things really quickly. Do you tend to have extra equipment just available but not being currently used? Because obviously in terms of unit cost and the return on investment on that particular equipment, how do you balance that with always being live?
Yeah, so that's the great thing about being a scaling company, right? Because we have to buy the other equipment for our new locations. So, and we don't buy one by one, we buy in bulk. We try to buy in bulk, we buy for 5. Usually when we have the money, we usually buy plan centers 5 at a time. So oftentimes we just have the equipment sitting, waiting to be deployed. And so if any center needs it, we can quickly give it to them while we try to fix stuff down. Just that's the natural consequences of, because the fact that we are still building many, many locations, we have to carry equipment to build them. Right. Yeah. So it just works out for us. Maybe when we stop building, then we have to say, okay, what is the best backup equipment to hold? So for example, for each of our machines, we would typically have mobile backups for them that we can send to teams in case if something happens to their bigger machine, like mobile ultrasounds, mobile x-ray machines, so that if something happens to their big machine, we can quickly like send that one to them. So we usually just plan for that. But right now it's a little bit easier because there's all this equipment sitting in the warehouse waiting to be deployed to a new location. So it's just like potato for me. So
Yeah, no, that's wonderful. So you mentioned that you're in another country other than Nigeria. So tell us about the expansion into that country and what were the challenges, what are what is venture?
yeah, so it's been a very humbling experience, obviously, going to a new country because you take a few things for granted. For in Nigeria, like, I used to think the Nigerian bureaucracy was crazy. I don't think so anymore. I
Oh,
think
really?
I was scared of that when I started to work in a different African country. So obviously we tried to diversify because at the time the currency was bad. And so we wanted to go to a new country with a more stable currencies that will kind of just help us in case if the things got really bad in Nigeria. And it's been a learning experience for us. So we were able to quickly set up there, start work. We've not seen the kind of growth we need to see, to be fair, but we've achieved some steady states there that, we know what we need to do, but we probably need more capital to do what we need to do. So, but to be honest, it's still like work in progress. They just turned 1 year, so they're still unprofitable, but we hope that within the next 1 year, they'll be profitable and then I can rest a little bit and not worry about them. But it's just shows that the grass sometimes looks greener on the other side until you get to the other side, right?
Yeah.
So things are challenging everywhere, and I think the core thing that I feel like if I were to enter this 2020, obviously, is that we set up our first location in a big city. I would love because when we set up in Nigeria, we set up in Ibadan first and Ilorin and Osogbo before we even did our first Lagos location. I wish we'd run the same playbook there, but we felt like it's we can go there and do it. Why not do it that way? But now we know better, right? So yeah.
So when you say that, is that because of competition or entry to market fit or a cultural context fit? What would you say was the
So it's
biggest
because
challenge going into that?
so it's a challenge that in healthcare, the currency of healthcare is actually trust, and trust comes from being familiar with you and maybe trying you out and stuff. When you go to a big city, you're not the only player in the market, right? There are so many players and that people have developed trust for 20, 30 years. So switching to you is much, much harder, particularly for and then big cities also tend to have majority HMO patients or insured patients, which means you need to go sign with the HMOs also to see those guys. But what that means is that signing with them takes a year to sign. That means you can never see HMO patients where the majority of the patients are HMO, and the other guys that are non HMO already have places they trust that you have to pry them away from. But when you go to a smaller city, number one, a smaller town, most people are not HMO covered, so more market share for you to play around with. And two is that oftentimes if you bring in something really unique into the space, you would automatically become number one because you're just better than everybody else. So it's harder to be number one in a big city because everybody else has all the big equipments like you do too.
That's wonderful to hear about that. So just talk us through, say I'm someone who wants to have some diagnostics done. How do I go about using your services, just for our listeners?
Yeah, it's so easy. Just go on our website, www.beaconhealth.io, and book a visit. Select the center you want to go to, select the test you want to do or a package you want to run, and then bam, it's done. And then, you can also just walk into any of our locations across we have, in Nigeria, we have 23 locations across 14 states. So in Lagos, in Abuja, in Port Harcourt, in Benin, in Ibadan, Osogbo, Ilorin, Share, Ofa, Akure, Ado, Ota, everywhere. Yeah.
Right.
Yeah. So it's
okay. And they make that payment on the website, and so they just turn up.
You can make payment on the website. Yeah. You can pay on the website and show up. Or you can show up and pay and on our website you can select a pay in clinic. So you don't have to always pay. You can pay in clinic option, and then we know you're coming, and then we'll just know to expect you. So it's quite straightforward actually.
Again, very wonderful. And this is one of the reasons why NomadDoc is partnering with your company to leverage upon your foothold in that industry, to make sure that patients have access to the best diagnostic test. I think you and I have spoken about situations where people have gone to get diagnostics done somewhere and the reports does not match what the reality is, which is what you said about trust, because why would you spend all that money and then the reports is not something that your clinicians can rely on? So you know, we're very grateful for the trust currency that MDAS and Beacon Health has built in the market. I think my final question to you would be, what advice would you give to anyone? Because you've talked about your journey starting from, you know, having medical people around you, and obviously you were not living in Nigeria, but you've come back and you've set up this company. So what advice would you have for anyone in the diaspora who's looking to enter into the healthcare entrepreneurial journey on the African continent? What sort of playbook would you give to them for success?
So, I think there's no one single, you know, I'm a Yoruba boy, so in Yoruba, we have this saying called Onokon Waja, right? So, like, there's different ways to the market, pretty much, right? But what I would say is, like, you do need to fall in love with the problem that you're solving. I think it's easy for folks. Oftentimes when folks are working on problems, they have the solution in mind. And so oftentimes they're in love with their solution. And even though the solution might not be solving the problem that they think they want to solve, but they're so in love with their solution that they would go invest heavily and build the solution out and excited and launch, and then they're surprised that nobody shows up, right? So I think, but to be honest, the problem we've set out to solve originally, which is our medical equipment, was a terrible problem to solve. Like a lot of the doctors don't have the funds to buy equipment. And even if you want to lease equipment to them, they don't want to pay 30% interest rate or 15%. They don't want to pay 20% interest rate, right?
Yeah.
So, and people told me back then that this, your model doesn't work. And I'm like, you're wrong. I know better than you. Obviously they're right. But the fact that my team and I fell in love with that problem so much that we're like, we will let it lead us to just thinking about the problem so hard and saying, okay, how do we make sure that people have access to services? It's like the equipment is just a means to an end, right? Is what we really want is for people to get access to diagnostic services or that this equipment provide. So is there a way we can provide that for people instead of trying to sell the equipment to the doctor, right? So it was just letting the problem lead us to the solution that worked, rather than saying, oh, go and build tech to manage medical equipment for doctors, right? Which is what some of our advisors at this time was telling us to do, right? But we just let it lead us. And even when people is like saying, maybe after we built our first clinic, people were like, you know what you really need to be doing is building the tech to aggregate all of the different diagnosis centers that already exist so that you can be asset light and you can raise money and this and that and that. We're like, look, the people that owns this place, many of these locations are not even in a place where they can be digitized. They're just so horribly run, and nobody is going to be able to digitize them. There's so much. Partnering with them will just be too complicated, right? And so we decided to go out and raise money to build our own centers. Even though people were like, it doesn't make sense, you will need a lot of money to do this and stuff, But we did it, and increasingly we've proven that our thesis around building a diagnostic network is actually correct. So people should because oftentimes when people are abroad, because I was abroad, I wanted to do something in Nigeria, and I was just daydreaming about the day I was going to move and do this and be in impacting lives and stuff. And I think that when I got to Nigeria and started running the first part of our business at the time, I realized the reality on the ground was different from what I imagined when I was abroad, and I had to adapt and kind of change the thesis of the business altogether. And once we got to product market fit, we ran so we started in January 2016. From January 2016 to November 2017. 2017 was our worst year. We literally was doing the first business, right? And it wasn't working, And I was ashamed. I was like, oh God, what did I do with myself? I moved all my life here and stuff. We launched our first center in November 2017. By March, April, I knew that, yeah, this is going to work. Right? It took me 2 years pounding my head on it with a model that didn't quite work, but I was trying to force it to work. But within 4 months, I knew something. The other model that we had, which is aggregates, set up a clinic we had 400 people coming through a clinic. We never ran a clinic before. We are not even doctors, but we just focused on like turnaround times, ambient, a really nice, good-looking, well-designed clinic, customer service. Who knew you smiling to your patients is a competitive advantage, right? And that's about it. And we got product market fit, and then we knew that we had something that worked, and then we eventually ran with it, and that's how we ended up to where we are right now. So yeah.
Yeah, no, thank you for that answer. So I will summarize what you said in saying that value-based care, which is ultimately, lands with the patients, and providing that last mile delivery of care is where you manage to unlock things, essentially. And you said fall in love with the problem, not the solution, is also the way forward. And also just realizing that you may need to pivot every now and again to get that market fit right. So yeah, very grateful for your insights and all your expertise on the topic. We very much enjoyed having you here on Nomad Doc Healthcare Stories. We are changing the narrative one story at a time, and we're very grateful to hear your story that's changing the narrative around diagnostic care in Nigeria. So thank you very much for coming on.
Thanks for having me.